Canada is buying more doses of the Pfizer-BioNTech vaccine. The initial order was for 48 million doses, all set to arrive by August. The government has an option to buy 3 million more, expected to arrive by the end of September. That means Canada is on track to receive 51 million doses of Pfizer this year, enough to fully vaccinate 25.5 million people. Far more unpredictable are the deliveries of the Moderna vaccine. Canada has received less than half of what the company promised by the end of this month. Anita Onnet is the Minister of Public Services and Procurement. Minister Onnet, welcome back to the show.
Hi there, David. Great to be here.
I want to start with Pfizer if I can. So we have some clarity now on the delivery schedule right up until the end of August. 48 million total doses will be delivered to the country by then, with an option to buy another 3 million in September if we need it. So it's spelled out. Is there a chance that could accelerate and you could get those doses even earlier than the end of August?
Well, just to clarify, we will receive the 48 million doses of Pfizer alone prior to the end of August, and we have purchased 3 million additional Pfizer doses to arrive by the end of September. In terms of accelerating doses, that is the work that I have been doing every day with my team to bring doses forward. And thus far, David, I guess you're asking the question because we've already accelerated 28 million doses to come earlier than previously scheduled. So the possibility is there for sure. But let's remember that the Pfizer shipments are going to be supplemented by the shipments of Moderna. We're going to get 1.5 million doses of Moderna in the week of June 14th and millions of more doses prior to the end of June and into the summer months. So all in all, prior to the end of September, we're going to have 95 million mRNA doses in this country. And that is very good news for our country as we move towards mRNA doses, generally speaking.
To get to that 90 million, I think we can have a reasonable level of confidence that Pfizer can deliver its 51 million because it's delivering a couple of million a week like clockwork. But that other 40 million would need to be Moderna, and they've delivered about 6, maybe a little bit less right now. So how confident are you right now? Because they're really struggling to get their European supply chain to work at a level of efficiency and capacity where they can even meet their commitments by the end of this month.
You're correct that Moderna has delivered 6 million doses to date. But I want to reiterate that I am on the phone constantly with Moderna to firm up the supply chain and the supply that is going to be available to Canada. They have confirmed millions of doses are going to arrive prior to the end of June. And I've also been working with them and the U.S. administration to ensure that we can take doses from the United States production facility at some point soon. So that's my goal. We got there with Pfizer. We now have all of our Pfizer doses coming from Kalamazoo, Michigan. And my goal is also to start bringing Moderna from the United States. And we're working very hard on that part of it.
Well, so where does that stand? Because that was going to be my next question, because the Pfizer situation got a lot better once you could tap into the American manufacturing stream that they have set up, because there are challenges with Europe, export controls and their supply chain issues among them. When will you know if you can start getting Moderna from south of the border?
That is the conversation topic every day. There are a number of conversations that are happening relating to the approvals that would need to be obtained in order for Moderna to switch its supply line. And so we will continue to press the company and work with the U.S. administration in order to have supply from Moderna coming from the United States directly. But I will say that Pfizer did switch its supply chain. That was very useful to us. But even before they did that, they did not miss a shipment to Canada. So the reason why I call Pfizer the workhorse of our vaccine portfolio is because they have on time delivered 2/3 of the vaccines into this country that we currently have. And that has been the case whether they were pulling vaccine from Europe or the United States. But as you say, the supply chain is more stable from the U.S., and that's what we are working on with the U.S. administration as well as with Moderna right now.
We've kind of gotten to the point in the vaccination effort where we're going to ask you, when are we going to get more, but also when are we going to start giving away vaccine doses? Because yesterday on the show, we spoke with the chair of Gavi, which runs COVAX, as well as the World Health Organization's technical lead. And as you know, there is this call for better off countries to start donating doses. Canada will have more than it needs at a certain point, but like, what is the tipping point where you decide to start sending doses overseas or to other countries rather than bringing them into Canada? We have metrics for reopening. Do we have a metric for donation?
Well, it's a very good question. Let me just start off by saying that while we have over 66% of eligible Canadians having received their first dose, we still need to ensure that Canadians have their second dose. And so that emphasizes the importance of continuing to bring vaccines into this country by the millions so Canadians can have their second dose. At the same time, across government, with Minister Gould, with Minister Haidu, we are having a conversation about that very question. When can we begin to donate doses? And there is the view across government, including with our Prime Minister, that we will be donating doses, and we want to continue to support pool procurement mechanisms such as COVAX. In the meantime, we should note also that we have donated physical items to India, for example, oxygenators, ventilators. So we want to continue to support the developing countries. We also this week increased our financial commitment to COVAX. And so it's really an all hands on deck moment for Canada, procuring vaccines for the country, as well as devising our strategy for international assistance to the developing world.
But, you know, Minister, as you just said, 90 million mRNA total doses by the end of September. That's more than the population needs on a two-dose regimen. So knowing that and being able to see that finish line, when can we expect a decision? I know you're talking to everybody about it, and I know the government intends to do it. When do you think we might know? Is it after the G7 when they're all going to talk about it? Is that a timeline we should look at?
You're right, 95 million doses of mRNA vaccines expected prior to the end of September in this country. And we are working very hard to make sure that we have the systems and decision-making in place to donate doses when the time is right for Canada and for Canadians. And that is an ongoing conversation, of course. At procurement, we work very closely with the Public Health Agency of Canada in terms of identifying what are Canada's needs in terms of our vaccine procurement. So again, David, it's a complex, but we will get there, and we will make sure that we are supporting the developing world. That's our priority as a government, as well as vaccinating all Canadians.
Okay, Minister Anand, thank you so much for your time.
Thank you so much, David. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.